Today's topic is menopause. I'm Dr. Vinita Singh, Associate Professor, Food Science and Nutrition Department, going to tell about what is menopause in detail. So, what is menopause? It is the transition from the reproductive to non-reproductive, and the word menopause literally means the end of monthly cycles or at the end of the periods. And it is an unavoidable change, and that every woman will experience it. And the date of menopause in human females is formally medically defined at the time of last menstrual period. So it is the definition means permanent cessation of the menstruation, and it is a permanent cessation of the primary functions of the human ovaries. What is the age of menopause? It is between 45 to 55 years, and premature menopause may occur less than 45 years also. And what would be the age? Sometimes it is genetically predetermined. Late menopause is more than 55 years. The average is 50. And like cigarette smoking and severe malnutrition and stress may cause early menopause also. So these are the different stages of the menopause: premenopause, perimenopause, menopause, and postmenopause. So premenopause is broadly defined as the entire woman's life before menopause. And during this phase, a woman will have regular periods and can bear children, and the sex hormones like estrogen and progesterone retain a steady balance. It occurs before 40 years, and perimenopause can begin 8 to 10 years prior to menopause, with the ovaries gradually producing less estrogen. In this phase, physiological changes are there and associated with the end of the reproductive capacity. The menopause, it ranges between 45 to 55 years. Once you have gone through a period of 12 consecutive months without experiencing a menstrual cycle, the ovaries stops releasing eggs, and this is called menopause. So what is postmenopause? When a female experiences 12 consecutive months of amenorrhea, that is postmenopause. What could be the etiological factors? Natural decline of the reproductive hormones like estrogen and progesterone, surgery, if you're having surgery that removes the ovaries, chemotherapy and radiation therapy, and if primary ovarian insufficiency is there, or hysterectomy. So, what are the types of menopause? Natural menopause and artificial menopause. Natural means if it is natural, and artificial means if there is surgical removal of uterus, and if there is any type of radiation therapy, sometimes menstruation stops. So this is the whole cycle: how menstruation takes place, how follicles gradually decline to release the hormones. This whole diagram explain the how menopause takes place. So what are the symptoms? The most common menopause symptoms are dry eyes, hot flashes, the changes of the moods, and the periodic libido, and weight increases, frequent urination. So these are the symptoms of the menopause. The physiological changes: skin also changes, it loses elasticity and less collagen from the skin. Weight increases, hair become dry, voice becomes deeper. Changes in the vasomotor system also, hot flashes, night sweats, heart palpitations, and changes in the blood pressure also. What are the hot flashes? Sometimes when women does not understand what are the hot flashes. So there is a sleep disturbances, anxiety, heart palpitations, and a sudden sensation of heat affects the chest, neck, and face, and the skin becomes red. So triggers of hot flashes may be warm surrounding temperatures, tight clothing, and heavy clothing, strenuous exercises, hot drink and spicy foods, caffeine, alcohol, smoking, stress, and fatigue are the triggers for the hot flashes. So what can you do for preventing these symptoms or for relaxing menopause stages? Like 7 dietary changes you can do to prevent hot flashes. That is, you can banish caffeine, less spicy foods you should take, eat more fruits and vegetables, and avoid alcohol but increase calcium and iron, consume soy, and proper hydration is essential. So I have already told you the hormonal cause and the night sweat. How can we prevent the night sweat? This is a very good diagram by which you can understand. You have to take soy, foods with vitamin E, foods with magnesium, fresh fruits and vegetables for relieving night sweats. So changes in metabolism is also there during this stage, that cholesterol level increases in the blood, calcium level decreases, there's calcium loss, bone loss is also there due to the decreased calcium in the bones, and digestive stress is also there. You can feel severe constipation in the menopause. The major and very important thing ki how a woman, how a female is taking their menopause. There are very different type of psychological changes the female is experiencing, that like irritation, mood disturbances, aggressiveness, tension. Sometimes the female or woman become emotional also, fatigue, memory loss, unable to focus, depression, anxiety, unstable mood, sleeplessness, insomnia, phobia, tearfulness. Sometimes you are having tears in your eyes, low self esteem, emotional upset. So, these are all due to the changes in the hormones. Social changes also, because of feeling that a woman holds about herself, and when the menopause starts, there's she experienced different type of um, psychology inside her due to the culture in which she lives, and how the way women perceive menopause is very important because it is related to the biological effects, and ethnicity and geographical location is also important. Pathophysiology, already I've explained. Hormones, you can see the diagram, how the different type of hormones are changing at different ages. Test and diagnosis, yes, history collection is important. After 1 year of amenorrhea, so FSH and TSH should be, these type of tests should be taken care of uh, for the diagnosis of the menopause. So FSH and TSH are very important uh, hormones during menopause. I've already told you managements. So different type of management you can do: non-hormonal treatment, hormonal treatment, and counseling. So for the non we should focus on the non we must focus on the non-hormonal treatment during the menopause. Like lifestyle modification is important, nutritious diet, supplement of calcium, exercise, intake of vitamin D, cessation of smoking and alcohol, and phytoestrogens. You should take phytoestrogens to reduce hot flashes. So, what are the natural ways to reduce the symptoms of menopause? You can see quit smoking, eat a healthy diet, more fruits, vegetables, grains, low fat dairy, enough vitamin D, always keep active and get enough calcium. Vitamins and minerals for menopause is very important. So, you can take different type of things like vitamin E, vitamin D, B vitamins for menopause. Minerals like calcium, magnesium are very important. Soy products, whole grains, beans and legumes, foods rich in calcium, rich in vitamin D should be eaten. And what are the foods to avoid, like sweets, stimulants, beverages, Coca-Cola, and spicy food, they should be avoided. So hormonal therapy, different type of hormonal therapies are there, like preventive treatment against osteoporosis and heart diseases, relief of menopausal symptoms, relief of vasomotor system to maintain the quality of life. It is important. Types of HRT, that is estrogen therapy, progesterone therapy, and estrogen progesterone therapy. What is estrogen? Different type of hormones should be given in the form of pills. Increasing estrogen is, we can naturally increase the estrogen through diet, through exercise, phytoestrogen, and herbal supplements we can take, hormone regulating supplements we can take, birth control pills, hormone medications. We can adopt healthy habits, and that we can really active in our life for fighting the menopause. So foods rich in estrogen. So natural estrogen you can take like fruits like apples, cherries, carrots, beets, plums and cucumbers, grains, barley, rice, wheat, seeds, may flax seeds, sunflower seeds, and fennel seeds. In herbs and spices, garlic, parsley, and clove you can take. So progesterone therapy, it gives relief in hot flashes. Estrogen and progesterone should be given in the form of hormones. So benefits of HRT, I've already told you, where it improves the vasomotor symptoms, increase in bone mineral density, reduction in colorectal cancer, and possibly cardioprotection. Disadvantages also there. HRD increase the risk of heart diseases, risk of endometrial cancer, breast cancer, Alzheimer's disease, dementia also. So one should use HRT for not more than 5 years. Counseling and guidance is very important during this stage. So it is important to understand the individual need and priorities, problems reported by women, provide patients education regarding the menopause. So advantages, if you think like advantages, so a lot of advantages there: freedom from birth control, protection from anemia, feeling of independence, hormonal stability, and advantage of senior citizens in the society. So in this topic, we have learned about the physiological, psychological, and social effects of menopause of women. For leading a normal, healthy life, women should take a healthy diet, sound sleep, and do exercise in daily routine. Thank you so much.